Born and raised in Newark and a proud daughter of Puerto Rico, Senator Ruiz has been in the state Senate since 2008. She's currently the majority leader. Prior to that, she was the chair, the very influential and important chair of the Education Committee. In those roles, she opposed the elimination of school-based funding services in 90 special needs districts, not once, but twice. Right? She not only opposed it, she opposed it in opposition to a governor from her own party. That takes guts. She did it, and it made a difference because those programs still exist today in providing those critical services throughout those 90 districts. She's all about mothers and children. She's funny that way. She thinks it's important. And while thinking it's important, she has worked on legislation to expand child care opportunities for working mothers and families. I know firsthand the mental health impact that has, the positive impact that has, because if a mom or a dad, for that matter, if a family member doesn't know how their child is going to be cared for while they're at work, it's dramatically going to affect their mental health. And I've seen it time in and time out, day in and day out. So it is a big prevention issue in regards to mental health. In addition to that, the senator sponsored legislation that expanded breakfast and lunch programs in school. No surprise to anybody, but if a child is hungry, they're not going to be able to learn, and they're not going to have optimal mental health. So I think that's a critical program, again, offered for children who otherwise could not have afforded it and maybe did not get breakfast that day and did not get lunch that day, things that we take for granted. The senator also sponsored legislation that created a comprehensive nurse visitation program for mothers and babies for people who otherwise couldn't afford it. I think the mental health impact of that is obvious, particularly if they are suffering from postpartum depression, and they certainly should be assessed concerning that issue. I remember well, I'm looking at my 28-year-old daughter, when she came home with her twin brother. They were preemies. They came home. My wife Barbara had it all nailed down. I was totally useless because I was terrified. But because our insurance program paid for a visiting nurse to come over, she came over on the third day and pretty much told us everything was fine. I was able to sleep that night, kinda, for the first time in 3 days. So I remember the importance of that and how much of a difference it made in our lives. Currently, the senator is supporting legislation that would remove the requirement for prior authorizations for someone to get medication if they suffer from a serious mental illness. That's very important too. Also in the past, we're very grateful. She has supported funding directly to the Mental Health Association, most notably for our Risk in Children Center and the Sure Addiction Recovery Program. And those programs have been able to thrive and provide important services because of Senator Ruiz's support. So with no further ado, I'd like to introduce my good friend, Senator Teresa Ruiz.
Okay. Good evening, everyone. Come on. You had one glass of wine at least, I hope. Good evening, everyone. First, I want to give, and if you'll join me in giving a round of applause to Bob Davison and Barbara Small and everyone who is in there who lifts people up when we are falling apart. Thank you for your commitment, dedication, organizations, and raising money for a critical venture. Bob, you reminded me why I drafted the nurse home visitation program. It was precisely because of that moment in time. I was committed to nursing my daughter, and for nursing mothers in the first days, you really don't know if you're feeding your child enough. And my insurance covered a nurse lactation specialist, and she came to the house, stripped down Silver. She said, feed her, weighed her, feed her, and she said, you just gave her 2 ounces. She said, you know what that is? And I will tell you that after that moment, I didn't sleep for 2 years, but I was able to nurse my daughter for 4 years of her life because I had gotten that medical attention that said, hey, you think you don't know what you're doing, but it's happening naturally and you're doing well. And she would check in with me consistently and just text. And sometimes you just need that little comfort level, right? The same way that you were able to just maybe sleep a little bit more soundly that evening. The truth of the matter is that unfortunately, and I'm not a statistician, and you can tell me that I'm wrong, that if each of you are sitting in this room and thinking about yourselves or someone that you've come across in your lifetime or a family member, we've all been impacted by mental health issues. It could be someone as close to us, or it could be ourselves looking in the mirror. I run almost every morning, and it's because I need that just to process, to breathe. That as I get older in life, moments of anxiety, and then you sit back and you say to yourself, imagine these stress factors compounded by normal things that are produced in other people's bodies that they have no control over. And that for far too long in this country, in this state, and in our communities, we demonized that. We never supported it. We stereotyped it. And of course, we riddled it with shame, almost preventing sectors of communities to seek out help and to say, hey, I am in need. And so it is wonderful that we have associations and organizations that always take an opportunity to say, it's okay not to feel right. It's okay to have those moments of anxiousness. It's okay to need help, but then there has to be an infrastructure in place that gets supported. That not once but twice, as Davison mentioned, that we had to go back to the table to argue to say, if a child is in crisis, how much better than just to go down the hall in the school where they feel safe to seek help? That in communities like mine in Newark, where accessibility to therapy and mental health services is so limited because so few are Medicaid reimbursable, that so many families go without getting access specifically for children in a space that's so critically needed. That when we talk about improving parks and improving our school systems and creating accessibility for public spaces, that is also fundamentally tangentially working alongside to produce a better quality of life for mental health for all of our individuals. And I think, what's today? Because I lose track of the days. It's Thursday. I'm not sure if it was today in committee or in Law and Public Safety. Senator Greenstein and I put forth a bill called Arrive, that now when police officers are reporting to an area of distress, that they will partner with many of you in this room to de-escalate those scenarios so that we're not criminalizing mental health behavior, but that we're seeking resources. But that has to happen with government support. That has to happen with philanthropic support. We can't keep doing things the same way over and over again, because that's the definition of insanity, as you know it best. Access to perinatal mental health access is also a discussion on the table. But I just want to leave you with this. It doesn't matter whether you're in elected office. It doesn't matter if you run a health coalition organization. It doesn't matter if you work in public service or if you're in the private sector. Each one of us contributes to our community in one way. And that's being an integral part as a neighbor. In the morning, say hello to someone you haven't seen. Trust and believe. I run every morning. When you say good morning, it's almost like I throw them off their track pace. Like, someone said hello to me that I don't know, because we're living in a society now that is almost encouraging people to be in silos, to separate, to focus on exclusions instead of inclusions, to say that diversity is bad, to think about cutting Medicaid that fundamentally funds the significance of all these programs in this room, and thinking it in a way that it won't impact our crises in America. The red, white, and blue as I know it in this country, the way that my dad saw it, the way that my mom has lived it, the way that my daughter will live it, is a much better place, recognizing that we are vulnerable in spaces, understanding that we have to commit ourselves and lean into spaces even when we don't want to, but most importantly, respecting each one of us. I too want to take an opportunity to just thank my office, and I'm going to have them stand, because they're the ones who keep me sane on a daily basis and moving consistently, because it always takes a village. My Yvonne, who many of you have talked to over the phone, BJ, Leah, and Taisha, thank you for being a part of the network that helps me respond to individuals, helps families connect to services, helps me put forth legislation that gets signed and supported and invested. I went to Drew University. I'm going to close with this because dinner's on the table. I went to Drew University when Tom Kean was the president. And recently, he and I were at an event in the park, and he said to the county executive, who, people think I don't have a boss. I do. I work for the county executive, although he'll tell you that he works for me. It depends on the day, I guess. And Governor Kean said to him, you know, she created the biggest walkout in the history of Drew University because of our lack of inclusionary programs for people of color on campus. And I said, yeah, I can't believe you still remember that. And he said, and I remember that 2 weeks after that you came and you asked me for a check to fund you to go to Africa. And I said, yeah, I sure did that within the span of one breath. And then Joe said, well, I guess you were born to just fight governors. I said, I guess I was. So if it means protecting a parent, a mother, a woman who doesn't have access to a social security number, an individual who doesn't have a voice, that is my purpose in office. I was born and raised in the city of Newark, a place that always gets wrapped in tropes and in stereotypes. I go down to Trenton to be sure that they know who we are, what we do, and what we're about. And I will tell you this. This state, this county, and our communities, they're much better than what we think. There is humanity in ways that we have yet to see. Don't let the people who are sucking the air out of every single room strip us of our energy, of our love, and our respect. And to Frank Delgaudio and Pat, who are here, who run the Essex County Mental Health Hospital, which is part of our, I don't have my glasses on, so I cannot see. I want to say a debt of gratitude to you. The county works in collaboration with many of you, whether it's a child in need of an early intervention program or someone who's in crisis who needs a bed. We're always putting Essex County first, and I'm proud of being that. Remember who we are, remember where we came from, and spread love instead of hate. Thank you very much.
You think you have a hard job, I have to follow the senator. Oops. Having said that, Congresswoman Sherrill, this is a flag that's been flown recently over the Capitol, and she asked me to present it to you.
I love this. I've never received one. This is like
That's
epic.
from Congresswoman Sherrill.
Thank you, Mikey. She's not here, but she lives in Montclair. Maybe that'll echo out in the streets. Thank you, everyone, and enjoy your dinner.